High infection rates, rising hospital and death cases. 100 days after Freedom Day, many in Great Britain no longer feel like celebrating. Doctors are alarmed and ask themselves, what about Plan B? If two things can only be partially reconciled, then it is the fight against the coronavirus and making resilient plans. Nobody should know that better than the British. Last December, the number of infections soared. A highly contagious variant of the virus spread in the UK. And Boris Johnson had to make a decision with a heavy heart, as he called it. He said, "We cannot continue with Christmas as planned." The British Prime Minister was forced to take tough measures in England. Contact restrictions, which should be relaxed over the holidays, have been tightened. And Christmas with family and friends was practically cancelled. "We are sacrificing our chance to see our loved ones this Christmas to have a greater chance of protecting their lives," Johnson said at the time, and so we can see them at Christmas in the future. At least this plan should work. The only question is under what conditions. Because now, 10 months later, the coronavirus could upset supposed certainties once again. Cautious but irreversible. This is how Johnson had announced the gradual lifting of the corona measures in England. On July 19th, the time had come. In the largest British part of the country, the last pandemic rules such as keeping your distance and wearing a mask fell. Young night owls celebrated Freedom Day, the great freedom, in the country's clubs. But almost 100 days later, many no longer feel like celebrating. Britain now has one of the highest infection rates in the world. The 7-day incidence was already around 450 in mid-October, and the trend is rising. The campaign, celebrated as a vaccination miracle, which started much faster than in many EU countries, is stalling when it comes to booster vaccinations for the elderly and vaccinating young people. The number of new infections, of course the new infections registered, has now climbed to almost 50,000. That is more cases than in Germany, Spain and France combined. And the number of daily hospital admissions is also increasing. It is now almost 1,000. On Tuesday, the number of reported corona deaths reached 223, a level last seen in March. So, is it now time for Plan B? Johnson announced this a few weeks ago for the winter if the pandemic could not be kept under control with booster vaccinations. But what is the plan? Well, it's the return to the obligation to work from home, to wear a mask, and the obligation to show vaccination certificates at major events. The emergency plans would only be put into effect if there was unsustainable pressure on the NHS health service in England, said Johnson. 10 Downing Street does not seem to see this pressure yet. Despite the increasing number of infections, a return to the abolished corona rules is currently not planned. At least Health Minister Sajid Javid said that on Wednesday. Plan B will remain in the drawer for the time being. Instead, efforts should now be stepped up to vaccinate as many people as possible. The British vaccination program is currently stalling, especially for young people and the elderly who are to receive a booster vaccination. At the same time, Javid warned that the number of new infections every day could soon rise to 100,000. Experts and medical professionals are also asking themselves how this should fit together. It leaves the action of 10 Downing Street confused and sometimes even dismayed. It is deliberately negligent of the government in Westminster not to take any measures to contain the infections, said the British Medical Association, the BMA. The government has promised to take a Plan B if the National Health Service is in danger of being overwhelmed. As first-line doctors, we can absolutely say that this point has now been reached, they say. The NHS also sees itself at the limit. "We are at the limit and it's mid-October," said the executive director of the Association of Sponsoring Organizations of the NHS, Matthew Taylor, to The Guardian. "It would take a lot of luck not to find ourselves in a major crisis in 3 months," he says. There are a number of reasons why the UK could face another major crisis. Perhaps the British are now partially undoing their vaccination miracle because the effect is already waning for many, as a data journalist of the Financial Times speculates. An effect that was also shown in Israel. The statistical comparison of different countries also shows that the completely unrestricted gatherings of people indoors are likely to have a large share, according to Financial Times journalist John Byrne Murdoch on Twitter. The epidemiologist Neil Ferguson from Imperial College London comes to similar conclusions. He's particularly concerned about the particularly high infection rates among young people. 12 to 15-year-olds in England have only been vaccinated once, and the vaccination rate is low. He therefore calls for a second vaccination for young people and an acceleration of the vaccination campaign as a whole, as the Independent reported. It only seems certain that nothing is certain. Shortly before Christmas, during the corona pandemic, the search for a master plan continues. And sorry to say this, but with this government it probably will continue for some time. I'll see you in my next video. Bis gleich.